This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
X1X Cough Expectorant is an effective solution for managing productive coughs. It incorporates multiple active ingredients to provide relief and improve respiratory health. Indications and uses. This formulation is indicated for the management of productive coughs linked to various respiratory conditions such as bronchospasm, bronchitis, bronchial asthma, chronic obstructive pulmonary disease, COPD, bronchiectasis, and chest congestion. It helps to ease breathing by thinning the mucus in the airways, making it easier to expel, and providing relief from associated symptoms. How it works. The combination of ambroxol, guaifenesin, terbutaline, and menthol works synergistically to thin and loosen mucus, decrease secretion stickiness, and relax airway muscles, making breathing easier and reducing coughing. Directions for use. Take this expectorant as prescribed by your healthcare provider. It is essential to shake well before use. The correct dosage and duration of treatment will be determined by your doctor based on your age, medical condition, and body weight. Always follow the physician's advice for optimal results. Possible side effects. Common side effects may include nausea, diarrhea, vomiting, and stomach discomfort. If these symptoms worsen or do not improve, it is advisable to consult a healthcare professional. Precautions and warnings. Caution is advised for individuals with liver, kidney, or heart diseases, high blood pressure, uncontrolled diabetes, hyperthyroidism, seizures, or a history of stomach ulcers. Pregnant and breastfeeding women should also consult their healthcare provider before use. Always disclose any other medications you are taking to avoid adverse interactions. FAQs. 1. What is this product used for? It helps manage productive coughs associated with respiratory conditions. 2. Can it be used by children? Yes, it is safe for children, but consult a doctor for the appropriate dosage. 3. Is it safe during pregnancy? Consult your doctor, as there are no well-controlled studies in pregnant women. 4. What are the common side effects? Nausea, diarrhea, vomiting, and stomach discomfort are common. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is always appreciated.